Okay, welcome everyone. My name is Avinash. I'll be moderating today's conversation. It's a pleasure to have you all with us, and thanks for spending a Friday evening with us, educating us, sharing your knowledge to the speakers as well as to the audience that's here tonight. I'm excited to introduce our panel of speakers. First, we have Joe Agarwal. Joe is the founder and CEO of Visa, the world's leading conversational AI platform to solve mental health, which supports up to 6.5 million users across 95 plus countries. Visa, as many of you already most probably know about, is very well recognized for its ethical AI and clinical impact with over 700 million conversations and multiple global awards. Joe herself has been honored by the World Economic Forum, Women Transforming India Awards, and Business Insider's Top 100 in AI. She's also a former UN Foundation Director and Pearson Executive. She's also worked globally to improve youth employability in digital care, is an IIT Delhi and IIM Lucknow alumni, um, and also advises MIT's Legatum Center and splits her time between Bangalore and Boston. Joe, thanks for your time. I'm sure you're like super duper busy with all the work that you're doing. So thanks for spending time with us today and looking forward to a great conversation. We also have Arisha. Thank you. We also have Arisha Siddiqui. Arisha is a digital transformation specialist with 8+ years of experience across health, development, and enterprise sectors. At Dimagi, she leads the design of mobile tools for mental health programs in sub-Saharan Africa, improving access and service quality for frontline workers. Her work blends user-centered design with deep contextual understanding of low-resource settings. With a background in behavior change communication, enterprise design, and project management, Arisha builds scalable, technical sound solutions grounded in real-world needs. She's passionate about tech for social good, champions digital innovation that enhances human-centered care in global health, global mental health, and beyond. And I'm Avinash, one of the co-founders at Quicksand. We are a social impact-driven design studio in the global south. I'm also one of the creative directors at Untreated Studio, which is a video game and Indian heritage dev-centric video game startup. My work spans human-centered design, speculative futures, and immersive media for global clients like the Wellcome Trust and MSF, amongst others. I also have a small artist profile by the name of Tirura, where I perform with projects such as elsewhere in India, where I explore AI and Indian futures. I also do I lead a lot of the work at Quicksand under the mental health umbrella, and I've been fortunate enough to work with the likes of Sangat and the Center for Mental Health Law and Policy, amongst others, to experiment with what it means to convert mental health research into immersive storytelling. Great. So that's just like quick introductions. I'm sure the speakers will also hopefully introduce themselves as we go along, but feel free to give a better introduction than I have if you feel it's more relevant with the first question as well. So on behalf of the Quicksand team, I'm delighted to welcome you all to our new platform, Prototyping Change. This is the third webinar in the first series that we've done under this umbrella. Quicksand, for those who don't know, is a human-centered design firm. We have been working for about 2 decades in India across various sectors of the development challenge, so to speak, in social development, health, climate, finance, and so on. We also work across South Asia as well as in several parts of Africa. And a lot of our work, and in some sense, that's where the name Prototyping Change comes from. Over the years has often involved making prototypes and also seeing the idea of prototyping as more than just bringing ideas to life, but we have also seen over the course of our wide-ranging work that prototyping is actually a way of learning. It's a way of improving your understanding of the world around us, and prototyping is also a way to help others in the journey of collaborative sense-making, which eventually is one of the pillars around which modern mental health work, like some of what we're going to discuss today, actually rests on. This particular webinar is obviously looking at the role of digital innovation. But before this, we've just to recap the first 2 episodes in the series. The first one dealt with the involvement of lived experience in mental health through a framing of lived experience experts. The second looked at climate justice and mental health. And today, of course, like I said, we're looking at the role of digital innovation in meeting the mental health care gap. A brief introduction on setting the context, and then we can begin. Trying to keep this like super short and swift in the interest of our speakers taking the spotlight more than me. As we all know, India faces a significant treatment gap in mental health care, especially for common mental disorders. Drawing from two leading organizations, Dimagi and Vaisa, we talk about how digital tools are reshaping mental health systems, particularly in resource-constrained settings. We ask, how are these approaches expanding access and what limitations and challenges are emerging? Our format today is pretty simple. We have a panel discussion for the first 40 minutes, followed by audience Q&A for the next 20 minutes. While the chat is going on, feel free to share questions in the chat. The chat is open. We'll try to address as many as we can towards the end. In today's conversation, we specifically are looking at how task sharing and digital innovation are reshaping access to mental health care, particularly in underserved settings, of course. We're joined by two global leaders, Dimagi and Vaisa, to examine what it takes to scale these solutions equitably and what kinds of care systems must be built to create a more inclusive and resilient future for mental health. While there is a growing recognition of the global mental health crisis, access to care remains deeply unequal. In low and middle income countries like India, nearly 85% of people with common mental disorders such as depression and anxiety go untreated, according to the National Mental Health Survey in 2015-16. Persistent structural barriers such as stigma, a shortage of trained professionals, and under-resourced health systems disproportionately affect people in rural and marginalized communities. Two key developments that are helping to shift this reality, and of course slowly but definitely shifting this reality, are essentially task sharing and digital innovation. Just a brief introduction to these concepts for those who might not be in the know. Task sharing essentially extends the reach of mental health care by enabling non-specialist providers such as community health workers, lay counselors, nurses, and others in the community to deliver support through structured training, supervision, and ongoing mentorship. This model not only addresses workforce shortages, but also strengthens culturally responsive, community-based care. Yet sustaining the quality of this care, ensuring adequate supervision, and protecting the well-being of frontline work providers, of course, remain major challenges as we all do experience on a daily basis in our kind of workings. Digital innovation, on the other hand, is obviously a broad umbrella term, but in some sense uh, is expanding how we understand and implement task sharing in the context of this discussion. Technology, of course, offers new ways to train, support, and supervise non-specialized providers, whether through mobile tools for real-time feedback, peer learning platforms, or apps that care for the caregivers themselves. Moreover, digital solutions such as AI-powered chatbots, peer support communities, and storytelling platforms are creating alternative pathways for early mental health support beyond traditional clinical settings. These interventions are often scalable, cost-effective, and adaptable to local needs, making them specially relevant in resource-constrained environments such as India. Together, these two approaches invite us to reimagine not just who provides care, but how, where, and for whom care systems are designed. Okay, thanks for listening for my introduction. That was a bit, hopefully that wasn't too heavy. And of course, we'll get to the meat of the topic as we kind of go along. Thanks again to the speakers for being with us on this journey. I'll start with the first, I guess, inquiry. We can keep it quite informal and collaborative in terms of a conversation. I'll try and keep my mouth shut in the face of the two experts that we have today and try and chime in where I can. All right, so for the first question, we're really looking at, I guess, the direction of our thinking for this one is looking at what does it take to design for real needs at scale? How do we ensure that our solutions stay grounded in real specific mental health needs rather than just scaling for reach? In your work, help us understand what helps balance the need for scale with contextual relevance and depth. I'd also like you to just introduce maybe some of your work in this context, let's say around scale, and we can discover more aspects of your work as the questions go along. So I'd like to invite Joe. Would you like to inaugurate the proceedings on the topic of scale? Yeah.
Okay, sure. Okay, let me tell you a little bit. I'll address this question with a bit of history of how we came about WISA, because how do you design for scale is something that even before I founded WISA, you know, my co-founder and I had been working on large problems, trying to help young people in conflict zones in Yemen and Syria, in Iraq, to get jobs, to get to not take the terrorist path. And we'd figured out that technology. So at that time, I would use something like a USSD where you do *123# on a phone which has no credit, which has no data, but it can still work to reach. And the day we would launch, we would reach 1 million people. That we'd have 1 million people using the service on the day we'd launch, and it would stay alive post crisis, post war. Whereas before that, every intervention that I'd done with a blend of, people on the ground, train the trainer programs, are typical ways of implementing change. The moment the war would break out, you had to just pull everybody out. So I think I'll just start with digital innovation, and where my faith in digital innovation came was very much having started, of course, being a techie, but having started not believing in it, and then seeing my projects vanish in the face of war, and then putting in tech, and then seeing it, in the next war, because in the Arab world, wars were very, you could really prototype around wars. It's sad to say. So in the next war, I would be able to see that it would survive that and it would still deliver impact. Um, and that learning, Ramakant and I brought into saying we want to solve for something. And the first product, when we started out, in fact, Wiser has made its name in the global high resource setting. It's used by people all over the world. It's used by the NHS. It's been used by the US Air Force and the government of Singapore. And now, after 10 years, the last 2 or 3 years, we've come back to low resource settings, but its origin was in low resource settings in India. So we started out, in fact, using tech to detect depression. We weren't going to use a chatbot. We were the first people to use an AI chatbot, a purpose-built AI chatbot. Today, mental health um, is the top use case on ChatGPT according to HBR. So we know that it works, but we found out in that grounding in reality. We were trying to scale the detection because we thought that if a doctor would know that their patients are depressed based on things that they don't have to ask their patients, you could actually send them to support. And so passively, by seeing how your phone moved out, we were able to build a technology that could tell you whether you were depressed or not. It could identify just by the movements of your phone, no tracking of your conversations or anything. And we were really thrilled, and we put it in a low resource setting and it worked, except that nobody got any support because the doctor would refer 30 people to therapy and one person got access to any kind of support. Everybody else got an antidepressant. Um, and we said, well, we're not solving the problem. And that, I think, comes to, every cool tech doesn't turn into a scalable solution, because in order to bridge the gap between a scalable solution that's grounded in reality and the coolness of the tech that can notionally scale, you have to realize what happens when you pass on the baton from where your tech has scaled that access, or even will that phone app be adopted by the user. So coming into you and after you leave, the problem requires many, many steps, right? If in your theory any of those steps falls down, it doesn't work. And now, at that point, we had, in order to gather data, added a small AI chatbot. It was just multiple choice kind of chatbot. And everybody who was using that chatbot, again, very low resource setting, rural India, Marathi, Hindi chatbot, which we're now doing again. But this was 2015, 2016 that we were doing this. And everybody who used the chatbot ended up showing an improvement in their mental health scores. So that's when that grounding in reality to say, yes, there is no therapist, but the good news is that this seems to be working. And I remember going to Dr. Vikram Patel and showing him the data, and he said, yeah, asking somebody how they are is therapeutic. And that's the first time I had the confidence, not being a clinician, that what we can do is potentially going to move the needle here as well. So sorry, this is sort of an origin story, but a couple of lessons that I learned in the beginning.
Yeah, thanks for sharing. That's super interesting. In fact, it's interesting because when I started my journey in working in mental health, which was exactly the same time around 2016, thanks to work with Sangat and Dr. Vikram Patel, in fact, as well, who's, I think, started many people on their journeys in mental health work, is when I first heard about Visa. And being kind of from the creative tech background, I was actually very interested in. That's around the time that we were also developing a video game with Sangat. And Visa was one of the kind of really interesting talking points for us at that time. And it's wonderful to see all that you've achieved. And it's amazing to hear that you're also coming through full circle and back to working in a low resource setting, and maybe bringing all these years of learning back to that challenge. I had a question, while, I mean, just to kind of follow up, and we can um, kind of move ahead as well, was in some sense, and I'm guessing this will come back more in this conversation, but just the top of your head response to what has changed the most about the work that you do in light of the global popularity of LLMs, and the fact that there's no longer a distinction in some sense between a chatbot for the user, like everything is a chatbot and nothing is a chatbot as well. We're kind of reaching a very funny space. And the fact that it's obviously gone far beyond words and text and into a extremely multimodal kind of a world we're already looking at as far as generative AI is concerned. So any quick reactions to what's the one biggest thing that you can see has changed in the last 2 years because of what's happening?
I go to all these forums where people have a lot of doom and gloom around AI, and I tell them to go to low resource settings and realize that any kind of translation, I think I look at large language models and the LLM revolution. The clue is in the name. It's all about just language. It is a visual language, an audio language. It can translate from text language to audio to visual, but it's basically a really excellent language generator and a language translator. And the biggest barrier for people in low resources is language. So I think in low resource settings, it's a huge equalizer. It is what is enabling us to grow rapidly in low resource settings, because you needed 1 year to get one language. And in a country like India, you'd never have enough volume to justify that kind of investment. But now you can go much, much more rapidly.
Great,
That's a quick
absolutely.
answer.
Yeah, no, thanks for sharing. And absolutely, I think you hit the nail on the head, because I guess that's one of, I guess in general has been the global realization that I think people underestimated the power of language in very simple terms in general, and what it means to far-reaching sectors, and how it is far beyond the cultural aspects that we've often kind of grown up thinking about. Has actually, I think we're realizing the power of what language holds to our existence as a society. And I think what you mentioned is absolutely true. Um, all right. So, Arisha, moving to you on the same kind of topic, what does scale like mean to you and in your work? And what maybe you can highlight a few things, that anecdotes that from your work at Dimagi, that helps us understand what are like the real needs at scale, and maybe how things change when they're at scale. And Joe, yeah, thank you as well. I mean, I think the what you expressed about how things change when you try to scale was actually super interesting as well, and quite insightful. Yeah, yeah,
Yeah,
Arisha.
totally. Thank you so much, Avinash. So what Joe mentioned actually resonates, and because I've worked in the social development sector, but I've very recently started working in the mental health space, and I kind of had similar doubts about the impact and effectiveness of the scale of these interventions, how impactful and effective these would be. But I think I resonate with the point that Joe also mentioned, that on ground, if you see the impact of just having one conversation with a person who is probably going through depression is pretty huge. You can see that they will be sparkle in the eyes. They would feel motivated just right instantly. So I've already seen that from my field visits and experience of the programs that I've implemented in Uganda, Ethiopia, in the conflict ridden regions. And that has been very empowering and rewarding for myself to work in this sector. And that has been my motivator to work in this field. And particularly at Dimagi, we have always believed in designing under the mango tree and following a bottom up approach. And one of the major things that we definitely want to try and continue doing is that we want to incorporate application feedback or the feedback into the programs through the implementers on the ground as well as the local facilitators. So we try to involve local implementing agencies as much as possible into our programs and implement it through them. Additionally, there is a very interesting application that I think you were also mentioning earlier, well, about like WellMe probably, which is a self-paced well-being and resilience application built particularly for frontline workers because they themselves are facing the burnout and the same issues that probably they are trying to solve for and service for. So even for when we were building Wellme and trying to scale Wellme for the FLWs, we definitely wanted to build for the real needs. And even though Dimagi comes from a background of 20 plus years of working with the frontline workers and the community health workers, even then we wanted to go ahead and with a blank slate, starting with the qualitative research, trying to speak with the FLWs so that our solutions are grounded in reality and we are able to build for what actually matters to them. So, from our qualitative analysis, we found out that this burnout, there's of course workload, but they also face a lot of there's hardly any recognition for the work that they do. That's truly a thankless job that they do, right? So the quality of their services can improve if only they just feel better about their own job and own work. So the WellMe application that was developed, we kind of added gamification, added scores and badges into the application so that they earn some rewards while interacting with that application. And that not just motivated them to keep using the application, increase the retention rate for the application, but also kind of made them feel a sense of achievement that somebody is recognizing, at least on the application. So that's how we are trying to just make very conscious design decisions, very small ones even, to make sure that the small changes also create some level of impact into the applications and digital tools that we develop for the users.
Great. Thanks for sharing. Could you give a little bit a sense of the scale at which the Magi operates, let's say in the WellMe or in general, like just a sense for people to imagine what the
Definitely.
scale is?
So
Yes.
surely. So WellMe application is something that was initially like it has been launched in 2023, but the formative work had happened with Johnson and Johnson Foundation, where the WellMe application was earlier called as companion application that was being built for a solution that they required. So that ultimately we transformed and through iterative feedbacks and we incorporate a lot of layers to it and made it what into the shape that it is right now. And currently it has been piloted with 1000 FLWs across India as well as sub-Saharan Africa in 6 countries with 21 organizations. So that's the scale we are looking at, and we are further looking into expanding the scope of the application itself by continuing to incorporate feedback from directly from different countries, frontline workers, and not just in health sectors. It is actually applicable for any kind of frontline workers.
Right. Thanks for sharing that. And I had a follow-up question in terms of just, I mean, one of the points obviously which stands out is that, like you accurately mentioned, that in general, there's been focus on training the trainers, but caring for the carers is not obviously that's a hard one to do in any kind of situation. And it's great that you've kind of leveraging some kind of advancements in mental health thinking and so on for these communities to do that. I had a question around in general that are there any significant challenges that you might have faced in any kind of scaling up? It needn't be in the context of only mental health, because as you mentioned, that is an area that you've been working on more recently. But in general, in the work that you do, are there any points or big challenges, especially when you talk about like the adoption of new technologies as well?
I think one challenge in context of WellMe that is a glaring challenge right now. We are the kind of model that we have is that we promote the application not directly through to the frontline workers. We need an organization whose FLWs are working with a particular with them. Okay, so in that case, it's difficult to find such organizations that are really concerned about not just the end delivery being made by these frontline workers, but also in the well-being of the frontline workforce. So that is very challenging, and it is difficult to explain the theory of change here, which is that we believe that if the FLWs are feeling better about their own jobs, and if they are not feeling the burnout or the challenges that they face, and if their mental health is in place, that's when the job outcomes will also improve. So that's a theory of change which is really difficult to get across the table. So that's one challenge in case of WellMe. And
Sorry to
in
interrupt,
general, I think,
but I mean, just for that challenge, that's actually obviously a very important and crucial challenge. I can imagine that happens. Maybe just a quick follow up on that. Can you share uh, a a failed experiment in trying to like convince people that well-being is actually important? Because that's kind of what it's coming down to.
yes, definitely. So, for organizations who have received, say, funding, I would, of course, not name the names, but I'll just tell you the
Mm-hmm.
instances that happens are because the organizations would have received funding for a particular intervention, which is why they would not be willing to, of course, for various valid reasons also, they would not be willing to put in any money into the well-being of the frontline workers in addition to whatever they are paying for their service delivery. So that's the major concern that comes up from these organizations that we are trying to talk about. So that's major reason, and of course, for these are valid reasons from their perspective, but there is still much more productivity that can be unlocked from these kind of interventions for their end objective of that funding investment or program.
Right. I get it. And is part of like mapping productive hours and things like that, is that the kind of like evidence mapping that one might in some sense need to do in work like this? And Joe, I see your hand up as well. Feel free to dive
Mhm.
in.
Sure.
No, yeah, please answer.
Yes, please go ahead, Joe.
No, please answer the question, then I can
Okay.
go.
Sure. So I was just saying, Avinash, that definitely that's one case where the frontline workers have to probably like uh, take up more of a role where like they are able to deliver the services, but not at the level that they can. So I think productivity can be unlocked much more, as I mentioned, but this is a difficult theory of change to get across the table in general.
Absolutely. And I'm just questioning you just to, in something, enhance people who are listening their understanding of the complexity of it as
Definitely.
well. Yeah. Joe,
No,
go ahead,
this is
please.
very interesting
Us.
challenge that we are
Sorry.
facing with this kind of a solution for sure.
Absolutely.
Yeah, I
Yeah, Joe.
just wanted to give a bit of structure to what Arisha just mentioned. Right? You have scale problem happens at different levels. So the problem that Arisha has solved is non-trivial with gamification, which is just that you keep a user engaged. Uh, and you get them to actually say that this was helpful, and especially somebody like a frontline worker. That itself can be a big barrier to scale because that tells you that you have a product market fit. You have a product market fit with the user. And that often is the first most important thing. But many products, tech products with product market fit with the users, do not scale because the scale problem comes on multiple levels. And I think if I was to simplify it, um, when I started in the nonprofit space, I had a whole for-profit career, and then I walked into this foundation or the social enterprise. And my first boss said he'd worked in Africa for the longest time, and he said, "Well, the one lesson you have is culture always wins." And whatever happens at scale has to happen with people doing what they would normally do. So what Arisha is sort of saying is that if culturally people don't believe that a frontline worker needs support for for this, if uh, like we're now trying to do work in schools, and if culturally the teacher is going to always talk at the student and not listen to the student, then the teacher's role can't be more than talking at the student and checking the copy, right? You cannot design a school intervention for mental health where the teacher's culture has to change, or in Arisha's case, the culture of the person that you're having to sell to have to change. So you have to find the stakeholder who is culturally aligned, who's incentivized, who wants this, and you have to find a model within which that happens. So that's just my little input. That of course, and the last level of scale is that, as long as it's grant driven, it will never scale sustainably. So you have to also make it sit within a context. For me, that USSD service that we launched was beautiful because it was sitting within um, Ooredoo, the telecom provider, as a part of their initiative to engage these young people in the Arab Spring. So they were sustaining it and they were doing what they do. If we were trying to do that through a foundation, it would never work because culturally they don't think tech. So that was just, sorry, my one. Uh,
That's a great provocation
addition.
in any case, which is a whole discussion in itself. Now thanks for your inputs. I think, oh, sorry, Arisha, would you like to respond to it?
Yeah, I think I totally resonate with what you're mentioning, and this is something that we totally realize with this kind of a solution, so that we definitely want to have a different kind of a positioning for such products, which are able to bring in value from not just a user perspective that it's for their well-being, but how the organizations could also benefit from it. So that's what we are also moving towards and trying to bring more funding into this space for this particular product moving forward.
Yeah. Makes sense. Joe, I really loved what you said about culture always wins. I think that's something I'll definitely take back from this call. I've been waiting for someone to say something like that for a long time. So that makes a lot of sense for me. But there is a peculiar paradox in what you mentioned, right? Because in some sense, what you're also saying, like in some sense, that you need cultural alignment from a key stakeholder who has the power to influence that situation. So you need cultural alignment with those people, let's say. Um, and in some sense you also need like independence from funders, and in some sense both are different challenges, but I can imagine they also need to work with each other, so to speak. And obviously the process and everyday challenge which we've been talking about as organizations to make those innovations happen with your team. So in some sense, does that mean, and if we say that culture always wins, does that also mean that we need to rethink the role and importance of culture itself inside the larger echelons of like mental health funding of larger organizations, and as also for example in the minds of scientists, where I've often faced, because I come from, let's say, the cultural side, and there is obviously a lot of resistance scientists and science practice also has towards culture, and especially in terms of us giving it the kind of importance that you're giving it when you say culture always wins. My question therefore is also that, do we need to therefore develop programs that are actually culturally minded and are cultural interventions, so to speak, as much as they're scientific? And is there room to think about these kind of opportunities in the sector?
You don't intervene culturally, you work with it. So I think there's another phrase that is often used in the context of acquiring users, but I would use it in the context of culture, which is don't dig a well, divert a river if you want to scale, right? So think about the culture as a massive river. And if you can somehow divert it in some way, align with it, um, in order to do what you're doing, you will scale. But if you keep digging wells, it will always be at pilot stage, right? At some point, you won't, because it has to fit in somewhere. Um, so, for instance, we're doing work with adolescent girls, and culturally, we want to say the intervention we would like to do is help you set boundaries and negotiate better with your parents. And, all of those things talk about your love life and SRH and all of those things that you want to talk about. But you apply this culture always wins filter. And one of our criteria is, and I think the Girls Arise program in Zambia also did this really well, which was, are the girls any more rude after having done this program to their parents or not, right? From a parent's perspective, are they actually easier to handle? Are they, because at home, if the girl is looking like she's going against the family's culture, she's going to get pulled out of school, let alone pulled out of this program. So you want to, make sure that they think that this will help her get married better, or that will make her a better mother, because that's what they're culturally, and that's not where my culture is, but that's where my user's culture is. And you have to work with that context. You can't get the teacher to try to change. You can't get the parent to try to change. You just have to accept it. There's a radical acceptance that you have to practice there, and then say, given that, human-centered design, given that, how maybe do da da da, right? And then creativity begins there. So you come up with much better ideas when you put those constraints in.
Absolutely. Great advice. Thank you. Thanks for sharing. Maybe we can use this as a segue to also move into, in some sense, the next topic that we were kind of hoping to speak about, which essentially looks at supporting frontline delivery through digital tools. For Dimagi, obviously, we spoke a little bit about WellMe. I believe there's another program, Peers, that maybe it would be great to hear from you about where you've learned, and also what you've learned about equipping non-specialist providers with digital platforms, because that obviously is itself a whole body of work and research that organizations like the both of you represent will be kind of engaging in. And also, how do you navigate challenges like protocol rigidity or risks of burnout, especially when training or supervision happens fully online? So I guess in some sense, yeah, I mean, if you can like unpack some of these layers of how these tools work, and also just to emphasize that I personally have also worked um, with stakeholders on, for example, developing a digital platform for mitigating youth suicides in India, or developing a storytelling platform for enhancing awareness of depression and anxiety and so on. And often like peer moderators, volunteers, in community intermediaries, as you might call them, are often involved. And even for our studio, even though we run a human-centered design firm and we should be great at figuring out communication and storytelling, it's still an immense challenge to work in these kind of settings to make something that might be looking great in terms of design and UI and UX and all that stuff, but might fail miserably in the hands of a real user, or in terms of learning and not really establish those things. So yeah, so maybe we can hear a little bit about that from you in the context of Dimagi.
Sure, Avinash. So I'll first speak about a little bit more about WellMe as we were just discussing it. So for especially WellMe is a self-paced application. So it becomes even more important for us to make it more intuitive by adding different, of course, like design uh, pieces that makes it highly intuitive, the icons, visual aids, incorporating engaging multimedia, etc. And for example, audio features that can help them read the content that we have added in the application with the help of that audio, and even capture the responses through the audio. So these are the very general high level items that we have introduced into the application to make it easier for and more intuitive for the users to navigate through the app. But overall, I think these steps have definitely helped us make it less dependent on any trainings. And additionally, we have within the application a training module that helps you like go through the different pieces that will teach you what the application is about, how to use it. Basically, a how to use manual is implemented and embedded within the application because it's required to be self-paced. That's where we kind of make sure that we are able to achieve the outcome through the application without making it too tedious for the users to go through, without depending on very extensive trainings and supervision. So that's what we try to incorporate wherever applicable. But of course, there are different programs that would not, where it would not be possible. There is still supervision needed. So, for example, in one of the application which we had developed for healthy activity program, which is run by Sangat, we had a piece where the supervision is done through the audio recordings of the sessions. So randomly, the supervisor will be able to listen to these audios, score them, rate them, and accordingly the FLWs will have a chance to improve their quality of service delivery. So that's one way. And you also talked about protocol rigidity, which is a very frequent challenge that technology consultants face, especially building tools for programs where verification also is an important part. So we cannot like create an application that has n number of flexibility. It has to have some level of restrictions as well. So in those scenarios, one of the program that we are still running with in Ethiopia in a conflict-ridden region of Tigray, with through the frontline workers for the patients who are screened as depressed or need of the GPM Plus program, we kind of recognized through the facilitators that there was a need of flexibly conducting the sessions, and they needed that they should be able to conduct sessions multiple times to accommodate the absentees who missed the session in the first time. So even though in none of the manuals on GPM Plus program says that this is allowed or permissible, but we had to include this flexibility into the digital workflows and tools that we develop, because it's important for the inclusivity where the clients are actually interested to come to you and still make for the session. That's why we had to build this functionality and this flexibility, but we definitely try to achieve fine balance here as much as possible. And therefore, when we implemented this functionality, we made sure that these makeup sessions, for example, are conducted only for the absentees and are done within a specific time frame itself, and are done only if there were some absentees in the first session. So there has to be some restrictions in place, and that's when you can still build in some flexibility. So that's a very valid challenge that we actually face while building and taking such design decisions into the program.
Great. Thanks for going into some detail on that. That's definitely useful. And because I think part of all of these kind of larger complexities is actually in the kind of detail that you described. So very, very interesting to hear about that. I had a follow-up question quickly on that, was just that often in work like this, when I hear like anecdote like what you just mentioned, it also feels like sometimes we underestimate the value and effort, the human effort that's still required in technological interventions. And often there is just so much happening in these kind of, exactly like the kind of detail that you described, and to do it 100 times, 1,000 times, 10,000 times, it ends up becoming like real human labor, which is then not accounted for in budgets, or the manager would have not thought about it when they wrote the grant application, or all that stuff. So wondering if that is something that you come across in other facets as well, which is this human technology kind of divide, which we have to understand much better.
No, true. That is a valid point, and which is why even these makeup sessions have to be, we can allow it only once after the sessions have happened, for example. Which is why what I mean to say is that you have to put your foot down at some point in time. So there has to be some restriction, and that definitely comes into picture, and you have to take a call for these kind of changes, even though that this might look like a very minor change into the application, but that definitely impacts the budgets, as you mentioned, the processes, the kind of labor required from the FLW side. So this decision has to be made taking all of this into consideration, and you definitely cannot provide the users the flexibility that they would have had in a pen paper model. So I think there has to be a boundary put together in consultation with various stakeholders, like what works and what's the limit and boundary at which we'll say no, we cannot go beyond this for so and so reason.
Absolutely. Thanks for elaborating. And Joe, that's a kind of a interesting way to also think about what we wanted to ask you was, in some sense, obviously Visa works with AI in a kind of a collaborative capacity where it creates a kind of a collaborative environment for the user. But it's also, but it's without direct human interaction, right? And it kind of is in that interstitial space, so to speak, which the kind of modern AI experiences provide, of course. So the question was, how do you address the complexity and the diversity of mental health needs in a model like this? Right? Because that's obviously like, I mean, often while everyone's still discovering the power of LLMs to be diverse, so to speak, I'm sure there's still criticism of following a one shoe fits all kind of a sort of critique I'm guessing you might be getting from across the board at times. And also, like a further question is kind of what role does for you as Visa? I know that design thinking in some sense has played an important role from what I have understood in previous years. So what role does that play in building trust, especially when people are skeptical of humanless care? And can you share any experiences where uh, this kind of pen and paper meets the tablet kind of a world of physical and digital strategies might have played out in Visa's work, maybe in the research or
Absolutely.
possibly even in the outcome? Yeah, go
Yeah,
ahead.
absolutely. I'll also try to incorporate a couple of questions I've seen in the chat because they seem to be aligned with your question on diversity. So people have asked about how do you account for culture in Visa, and also how do you make sure that you've got queer, BIPOC, and other marginalized populations included. So um, and they've also asked how we address systemic barriers, but I'll take that separately. I'll just talk about diversity and this kind of thinking. Uh, so I think the one word I would use is co-design. That we, if I did a one word answer to that, that we always co-design with users. But that co-design doesn't necessarily have to look the way people traditionally think it looks. So a co-design in a digital world doesn't necessarily need to be we are sitting in front of a user and they're telling us something. Because from a wiser perspective, for instance, we would co-design with millions of users. We, in fact, used to call Wiser the largest co-design between techies, designers, people with lived experience, and users. As an example, we would have 10,000 people whose significant other had cheated on them, refused to do a cognitive restructuring exercise. So, as a group, even though the clinicians were saying cognitive restructuring is what you do with this kind of unhelpful thought, this thought is unhelpful, let's find a more helpful thought. But if the partner had cheated on them, they were like, I'm not doing that. They wouldn't have said this to a therapist, but you're giving them that voice and they're saying that. And they're saying that across cultures. So they're saying that in Japan and in South America, across cultures. So we had to redefine what culture means. Sometimes it's just if you're in a certain domain, that's how you feel. If you're in a certain context, that's how you feel. That's your tribe. People who have had partners cheat on them are a tribe, apparently across cultures. But of course, neurodiverse people were big for us, queer people, trans people, people who have English as a second language. So we would go looking for data for people who have indicated old people. Who are over 50, so lots of mental health issues are for old people and they don't uh, have tech. So some places we just look for data within WISA's own data. So we have over 40 peer-reviewed publications. Many of them are in looking for data for instance, young people, old people, or we'd get grant funding and we'd actually run programs where a lot of the assessment is happening offline. So, for instance, if you're working with old people and you're not even sure they're going to use an app or a digital service, and what you find there is their biggest barrier to using the app is, especially in the US where they've got these Apple phones and you're downloading an app requires you to remember your Apple ID password, and they've forgotten it. So that's why they can't access the app. So you find these things which are so outside your zone of where you think you can intervene, but you know that if you're going to scale, you're going to have to find a solution around it. So we went beyond an app and we started creating digital widget-based platforms that don't require a download. And you talked about physical. So our most recent and most exciting, I would say, work that we are doing right now is we're converging all of WISE's um, sort of impact work in India over the last 3 years to the one area, adolescent girls, where we are seeing the most impact. And in that, the girl doesn't have a phone. And she doesn't have, she has access to the phone. You do know that during COVID and otherwise, because of the way the CBSE books are, there is a QR code. So there is comfort, cultural comfort with uh, a parent giving the girl a phone for a QR code once in a while. But the parent will look at the book, and if it doesn't look like, a book that is teaching them the right thing, they'll say that you're just chatting. So you want to design something. So we designed an activity physical book that that feels really exciting, something that I would carry through life. And our objective there has been that she should carry this with her when she gets married, so that wherever she gets access to a phone, you know, in if eventually she has her own phone, but anytime she doesn't have to have an app on the phone, she's not linked to that. She has a book, and then she can read all the good things people have said about her in the book. She can carry a sense of identity that she formed when she was an adolescent through times when people are trying to redefine it. She can learn techniques which are just written down as activities she's done, but she also has QR codes all along for situations that she's dealing with, and she can chat with them on that. And with that design, we've been able to see girls very excited because they have something physical to hold on to, parents not as judgmental because they can see what she's going to be talking about in a book, but keeping everything that she wants to keep private in the digital domain. So the AI chatbot is where all the private stuff is. Whatever she's writing in the workbook is free to be shared. It's not something that's super private. So what I'm saying is that when you put all these constraints and better ideas come out, you get more excited by the innovations that you come up with.
Sure, that's a great example. That sounds like a fascinating project, and I'm guessing we'll learn more about it in the coming months and years as you develop it, and looking forward to that. It also a good segue to essentially the next topic we wanted to talk about actually was around essentially to which part of what you're describing kind of also speaks to, which is around how do you overcome issues of access in general. So obviously in India, we know that data costs, device access, lack of privacy, especially for even certain segment more than the others, like you just mentioned. These are often, like in some sense, the digital tools exclude their own audiences, so to speak, right? And I'm sure we see that in our work sometimes where it kind of starts working against the access itself, even though that's the premise of the project. So how do you kind of move beyond this, and how does, I mean, you already answered it obviously in some sense of how does design and community engagement play a role in overcoming this access? But could you share an example where of maybe something that happened, and for both of you, obviously this question goes to is around how you adapted a tool or an approach to better fit a community's cultural or emotional realities, and how did you maybe meaningfully center local voices, maybe from underserved groups in your design process. And having been trying to do this and quicksand as well for several years, how do you do this in a way that it kind of builds trust and safety in mental health engagement itself? Because often, for example, when we work on things like mitigating youth suicide in young people in India, the act of creating a safe and trusted and creative mental health engagement space with the co-designers, so to speak, like you mentioned, itself is a whole project in itself, right? It's, I mean, and the project is not even started. You're literally trying to like create the space within which things will happen. So are there examples from your work where maybe some of this has happened, where the safeguarding and the preparatory work itself was quite consuming? And in general, speak about any innovations that your organizations have done to overcome the constraints of access in your beneficiaries. Arisha, you want to?
Can
Sorry,
I?
Joe, you can go first. Yeah, please.
I'll just continue from the earlier example, so then people will remember. Um, so we always say users, though, Avinash, never beneficiaries. Have an allergic reaction to the term. If you're doing
My bad.
design.
My bad.
um, but we yeah, so what was co-design? The same place where we had done the first 2015 study, we went back and we got adolescents, young people from the same community, and we said, start using the app. And it was humiliating to understand. We thought, oh, we've now done it in Marathi and Hindi, and they're going to start using the app. But culturally, what they want is answers. Culturally, the user doesn't want to be asked as many questions. Culturally, the user feels that the language of an LLM augmented thing is too academic. They have a lot of, so we had to redesign the entire product we did for high resource. It was not translation. And we did it through co-design. So what we mean by co-design is that you sit somebody in that community every Friday, that week's work goes, and people are sitting in different centers, they're testing it out, they're giving you feedback. And then you set up sort of one table. So this was inside a clinic for kids with type 1 diabetes who are underprivileged, and they would come in every Friday for a check-in, and we'd have a table where they would come in and they'd test one of our features, and they would then it would either help them or not. And every Friday you'd have a different bunch of kids. So you'd get to know whether it's working now or not. And it took us a year of iterations before we could say that there is one bot that worked. So design is a very humiliating process. If you can't, be happy being humiliated, you shouldn't bother to come. Just my learning.
Absolutely. I think that's great advice for any designers or design thinkers. And I think that's great advice to start with. And humility is it's an essential part of or arriving at humility through by being shamed is over time is definitely a part of the design process people don't speak about enough. But yeah, thanks for bringing that out. Arisha, you want to go?
Yes, definitely. So, yeah, I was laughing out loud when Joe mentioned that it is definitely you have to have a thick skin for sure as a designer, because some of the protocols like we would have from the manuals also, WHO recommended manuals, they sometimes have questions like that would not work at all in a community. So I have an anecdote again to tell you that one of the implementations where we have, so it's IPTG, which is interpersonal group therapy. That's definitely, let we have to as a protocol follow if any there are any suicidal clients identified through the PHQ-9 ninth question. Then they have to follow a certain pathway and a workflow where we have to go through suicidal operational guide, asking some more questions, etc. So those questions also had questions around alcohol consumption, etc. And these are not at all taken well in the community once we had implemented. And we were like having people coming back to us very offended about being asked such questions, especially in Muslim communities. So that's how we learned that we definitely either need to reframe these questions and ask them more sensitively, or skip altogether for particular communities and build the workflows in that manner and that way. So I believe these kind of contextual realities you learn from the real world implementations and from very verified protocols and user manuals also. They will also not really give you that contextual awareness of how to implement a tool in a particular community or culture. So that's something that I've also faced personally for the applications and solutions that we have built recently for tackling and catering mental health programs.
Thank you. Thanks for sharing. And that's definitely also in line in general with the prototyping change series. And I think both your examples in general definitely hark back to this idea of prototyping that I was also looking at in the beginning, where I was framing the idea of around prototyping as learning and prototyping as research, as a form of type of formative research as well. And I think in the context of digital solutions, I think fortunately prototyping is baked into the recent history of digital products and their innovations. And so I think that definitely makes it quite an interesting discourse overall. I'm also looking at the time and thought that maybe we could just do one last kind of a short exchange before we move into Q&A, though some have been answered. Thanks for that, Joe, before. And this is more of a personal question, I guess. It's essentially looking ahead, like as all of us working in the mental health sector, I think we are quite aware that while keeping up a positive attitude is super important, humility is very important, and hard work is important, talent is important, and there's just so many like criteria that you need and to check the boxes as an organization working in this space to get it right. Um, it also can lead to, in general, a sense that there is a huge, huge, unsurmountable challenge, and our organizations are working too slowly. And even though you might be, and Dimagi and Vice are obviously super successful, but I'm guessing with the both of you and your colleagues, there is often a sense of this unfinished kind of feeling that there's just a lot to be done. So, but despite all these barriers, there's obviously a lot of progress which both your organizations are representing in this country and in South Asia. So I guess my question was really, A is like, what brings you hope in general, as an individual professional, so to speak? And as an institution, what sort of partnerships, shifts in practice, or innovations do you see as hopeful signs towards building more equitable and scalable mental health care systems? And is there any one idea or principle that you want to leave behind for the audience today? Who would like to do that? Joe, you want to go
Arish,
first? Oh, okay.
yeah.
Arisha, sorry. Go ahead. Sorry.
Sure. So I think even with the international development funding being kind of shrinking right now, even then I still have hope because mental health sector has just started receiving the attention it deserves, and there are still a lot of specific grants and fundings opening up for the mental health sector. Some of them, like what I know of, is say Welcome Trust that's calling for scaling digital mental health, then Being Initiative by GCC, which is Grand Challenges Canada, focusing on youth mental health. So these kind of initiatives from the funders is kind of a little bit hopeful to me in person. Of course, still the funding is not even close to what the requirement is, and there's still huge gap, but it is at least starting and beginning of something that can increase and can be realized later on. Other than that, I also feel that the even though in India in particular, like there is a mental health policy which is there, but I've also started seeing some level of traction, at least in the South Indian states where I've come from. For example, in Karnataka, I've just recently had a conversation with the implementers of Manasi program, which is a Friday clinic being run through the, I think, some kind of a collaboration between Rotary Club of Bangalore and Government of Karnataka. So these kind of interventions are really a ray of hope for me, and I think these will help us move towards sustainability, and we will be able to move forward beyond just piloting different kind of interventions.
Thank you. I hope so too. Joe?
So I'm mixed. I'm very doom and gloom on one hand, and I'm very hopeful on the other. Um, so this is I'm 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 really nervous about the upcoming generation, because we're not leaving them a very good planet, and especially, there's this the triple whammy of adolescence done in a social media world, um, of increasing mental health crisis anyway with climate change and all the other sense of the future, and now AI really making them question their own relevance. And it's AI is a privilege, but it also breeds weakness. So what it will do, what social media did, the dark side of AI, what it will do to the young people who come in, and how livelihoods will suffer. So it's uh, I think, from a mental health perspective, what's very clear is that it will become a priority for every government from a skilling perspective. I think so. That's where I'm putting my bet in mental health. India has $100 million of funding for mental health, I've been told, of which 80 million goes into NIMHANS. So I might be inaccurate in that data. It's something I'm repeating what I've heard. Um, but but skilling is the background I come from. And skilling has a lot of budgets, and every government needs to focus on skilling and employability. And I'm seeing mental health and resilience and the ability to focus, ability to do work, all of those becoming one of the key reasons why people are not being going to be employable in the future, in a world where AI can do a lot of the other kind of skilling that we would do. The ability to form relationships, to navigate, to resilience, all of them will become much more critical. So I do see that, in a country like India, where there is a lot of now access to digital infrastructure, a lot of need to leapfrog, and a focus on youth. Um, youth employability, uh, we will be able to leverage that. So I would put it much more. I would just give mental health. That's where I'm betting on. I want to solve for adolescent girls' mental health in 5 years, and I'm betting on schools being the one lever that allows them to navigate the community with some kind of support, where they can't have an opinion, but if the school asks them to do something, they can do it. So I'm using skilling in schools as my lever.
Thank you. That's super insightful. I think a lot to take home with both your thoughts. Thank you again for all your powerful insights. It's been super interesting for me to hear your perspectives on it. And hopefully we can chat some more in the future about mental health. I wanted to open the floor now for some quick Q&A for maybe 10 minutes before we wind up. I was wondering how we should. Are there any? I mean, I know that Joe, you already addressed a few that were in here. Arisha, do you also want to just maybe scan through and see if there are any questions that you would like to address per se from your perspective?
Yeah, skimming through, yes, there's nothing specific that has not been covered already. Yeah.
Yeah, that's what I thought. Yes, I think most of the questions were addressed. There was a question around bias, which obviously is kind of a burning topic in AI for obvious reasons. I have dropped in a report in there which could be of relevance to, which is something that Quicksand actually did with an organization called Digital Futures Lab, who are based out of Goa, who work primarily in the field of AI and ethics and have been doing a lot more work in public health and gender and AI. So this report that I dropped the link for on the chat is super useful for someone who might be interested to unpack the nuances of how local language LLMs work with gender, which is again a very intersectional and fast moving emergent topic for research right now in India, which with I'm guessing both Dimagi and Vaisa will be thinking about those topics as well. But on that, we could have a quick chat on that, though. Because when I was working on this project, which essentially is intersecting obviously the rapid growth of LLMs in the English speaking world, the rapid emergence of local language LLMs, which are going beyond Hindi, and obviously there are lots of government initiatives, private foundation model talk happening, as well as all the global language LLM, global LLMs adapting to local languages, all that action happening. And then of course there's also gender bias in general in society, in our sort of learning materials, in our stakeholders, and sometimes how they would engage with women or other genders. So what would be your perspective on this? I guess my question is that obviously for both your organizations, enhancing or overcoming racial bias or gender biases would be of paramount importance. And yet some of these might be beyond the scope of your organization because you might be depending on a much larger LLM infrastructure that you may not have control over. So how do you navigate that space between the growth of these technologies and what you feel are good values and processes internally?
Can I take that?
Yeah, please.
So I have a slightly, I always have a little original and different thinking on everything, but on this as well, on bias. I feel like there is far too much emphasis in testing for bias in things that users don't care about, but testers care about. So testers care about whether when you talk to me, you're using the right language. Users care about when you talk to me, even if your language is a little off, are you helping me? Are you accessible to me? Um, what we've found is, for instance, uh, Wiser before it was LLM enabled, we would still be used by people. And when you write a one size fits all, you always will not be able to address exactly what the person is saying. And users would say that, yeah, that's not what I meant, and or you got that bit of what I'm saying wrong, or I'm not a boy, I'm a girl, or something like that. But they would still go back and say this was really helpful. Thank you, because it's really in mental health especially, it's about holding space and making the person feel safe. And so I feel like if we are testing in a use case like mental health, we cannot just test the AI. we have to test the overall experience, and we have to say whether or not the user found it helpful, whether or not it actually moved any clinical outcome, whether the user felt safe enough to open up. Did they shut up? Did they open up? All of those things are as important or more, because otherwise, you can just run a tester and say this LLM, okay, its bias has been cleared and AI bias is gone. That does not mean that your conversation is not going to be unhelpful, particularly unhelpful to an older person or a young person or a trans person, so on.
Absolutely. I think that's a great example. And even in our own testing, and we happen to have the opportunity to observe AI testing going on. Like we happen to observe like certain organizations testing their chatbots from a M&E perspective with their communities. And that was super interesting. And I definitely, our team also spotted exactly what you said, that in some sense, the testers are the user group that you're trying to satisfy often, and it's not the other user group. So that's definitely a great observation. And I think that's a lot to kind of think about that in terms of how we design our programs. And also the other thing I realized with our team was that there is also a new user, right? In some sense, the AI is also in some sense it's fills up a kind of a, because of the personification that automatically happens when users work with AI systems. It also we also got the feeling that there is a third person in some sense. There is another user basically, right? And in some sense that is personified by the AI itself, and this kind of collective intelligence that it represents as a persona. And I definitely felt that from at least from Quicksand's perspective, for me, as we research more AI systems, it feels like there is a lot more nuance and unpacking that needs to be done of what does human-centered design mean when more than human, it's more than human beings are also part of that space, and you're making space together for mental well-being. You're creating that space together with a algorithmic system. That there are also, I think there's a lot of work that needs to be done in evolving human-centered design methodologies to also fit this kind of a new context, which is far different maybe, and has a bit of alchemy, I would say, compared to the situations we've gotten accustomed to. But yeah, thanks for sharing. Super insightful. Um, um, I would like to kind of like also think about one last question, which was maybe just around I mean, it's a typical kind of a topic to talk about, which is kind of depressing sometimes on the Indian scene, which is talk about funding and grant writing and grant applications. And I know that you, as Vaisa in its earlier days, or might still be continuing to write a lot of grants and writing. I'm sure Dimagi does its fair share of and I do as well. So from the common point of misery, I would say, are there any kind of and I know that there are a lot of people on this call who would also be hearing this talk later, who are researchers actively trying to, desperately think about uh, how do I get funding for my next big idea in mental health? How do I become part of a grant-led organization, so on and so forth? Could you elaborate a little bit of from your perspective on, and also just to add that there is a kind of a, I guess hype would be the right word, that adding AI to your workflow will ensure better funding opportunities, and that if you don't have AI, then no one's going to fund you. There's all these kind of like things, myths going around, and I guess I would just want to understand from both your perspectives, of someone who's kind of obviously an expert in this field and treading new kind of pathways as Vaisa, and obviously Dimagi, who's been a healthy kind of user and kind of a stakeholder in the digital tool space as well. And increasingly your work in mental health, you're increasing, like you said. How do you view this paradox of funding, and should we fall for the AI hype and think about AI in all our grant applications?
Arisha?
I think I have a very less experience of directly working with the funders, but I can tell you from the experience that I've had with one of the funding that we have for building a mental health chatbot for a UNICEF funded project. It wasn't like it is an LLM generative AI implementation, but I'm sure that the grants and fundings we are applying for, that doesn't necessarily just say that we are building through AI. I don't, I have seen certain applications which do not just highlight that, because as Joe was also mentioning, that having own AI or having properly functioning with and properly tested AI is going to work. I think funders are looking for a wholesome solution, be it with or without AI, in my opinion, and that's what my organization is going for. Of course, there is importance that is required to be given to AI wherever the use cases are, but in general, the organization's approach for now, what I've seen is that wherever it can be helpful, that's where we plug it in while applying for funding. But if we see that it's something that's maybe not required, that's where we do not really go after and chases just for the sake of hype. So that's what my take has been, and that's what I've seen my organization being doing so far.
Yeah, thanks for sharing
I
it.
can maybe
Yeah, go ahead, Joe.
um, I can maybe take it both. I've been on the funding side and I've been on the, applicant side. Um, so when you're applying, I think there are three broad things that matter. One, it gets easier once you build credibility, right? So this grant funding has a lot of what in labor markets are called information asymmetry. So you know how good it's going to be. You also don't know. They don't know whether you know, and they don't know. And there's somebody else whose job depends on allocating funds appropriately. So the more credibility you have of having done something before successfully, the more likely you are to win. So if you're fresh and new, it's always going to be hard. So I would suggest find quick ways to prototype, create your own research, get some outcomes that don't rely on research funding. That's one way in which AI can really help in quick prototyping. So use AI to uh, not need funding in order to get to the first level of evidence of what you can do. That's one way in which to look at AI. The second way is what a grant funder always wants to do is is try to solve something that is previously unsolved. So they're not trying to solve problems. Generally, a new grant funding gets unlocked if there is a new idea that solves what was previously impossible. So then AI becomes a little relevant because there's lots of things that funders thought were impossible. So there's a lot of received wisdom in the funding domain. This doesn't work. This doesn't work. This doesn't work. We've tried that. Yeah, we did that in Africa. That didn't work. You throw AI in the mix, there is a little bit of openness to saying, okay, maybe it will work this time. So you're playing the person. And that's my feedback has always been that when you write a grant, don't pitch your idea, pitch the person. So, how are you going to make them believe that this is going to work this time? And last, and possibly the most important thing is what we've tried to do in how we apply for grants is that we start out first by doing for profit work. So, you start out by pitching and getting people to buy your work on its own. And then you go to grant funding. So whether it's a user acquiring it free, but no grant funding for that, and then going into a government and being able to sell to government, even for free pilots, being able to do that yourself and then bringing in a funder becomes that much easier because every funder needs a path to when this is going to work without us. Most people say yes, it will happen. Very, very few of their fundings ever go there. So if you've already worked with the government and you say, yes, now if you fund us, this thing is going to be a government project. Already I've tied that up, and you're funding a government project that they will take on. It's hard for individuals to do, but within any ecosystem, those are the kind of fundings that I'm seeing funders be much more comfortable with because they see an end in sight. Because again, the first thing, right? They have no clue whether it's ever going to be not dependent on them, ever going to scale or not.
Now, that is like super relevant. I mean, I think those 3 points are like super relevant for anyone who's trying to embark on writing proposals. And I'm hoping I took notes, but I'm hoping people who took notes, this might impact your grant writing for sure. So thanks for sharing. I think this is actually very, very valuable advice for anyone who's paying attention to that. Well, thanks to both of you for your time and efforts in bringing this talk together. I think it's been a very interesting discussion on something that's maybe not spoken about so much in this nuance. So it's kind of definitely, I would say, a special interest discussion, but touching on very, I think, small nuances that in general, I think would have great ramifications for people who would like to expand these learnings into their own organizational systems. I just want to close the proceedings by, in general, thanking everyone who's been with us on this journey of 3 webinars, thanking the people who came in today. A few quick notes that we have a video recording and transcript going on. We'll send it to all the registrants. Feel free to share that with your networks and friends as you feel right. You'll also receive an invitation to upcoming webinars in this series. The response has been actually really, really great. And Faith Gonzalez, who's been in the shadows working on this, I want to shout out to her and thank her for her time in bringing all of these together conceptually, intellectually, and organizationally. I'm just a puppet who's been well prepared by Faith. So thanks to her for this. I also wanted to kind of invite people to feel free to reach out to our speakers. Their contact details are available in the follow-up mail, and they've generously agreed to even share that. And hope that some of you might have some collaborative kind of discussions with them in the future. And finally, any feedback or suggestions on future webinar topics, there's a short feedback form after the session that you could fill up if you have some time. Let's keep the conversation going and keep prototyping change together. Thanks to both of you, and have a good evening, everyone.
Thank you so much.
Thank you. Bye-bye. Bye, everyone. Thanks.